Postoperative abdominal adhesions. Abdominal adhesions are bands of fibrous tissue that can form between abdominal tissues and organs. Normally, internal tissues and organs have slippery surfaces, preventing them from sticking together as the body moves. Abdominal adhesions cause tissues and organs in the abdominal cavity to stick together. A serious and frequent complication of surgical interventions. Adhesions develop during the first 3 to 5 days and can require additional surgery and hospitalization. Postoperative adhesions distinctly affect the life quality of patients all over the world. Frequency of adhesions forming. 67% to 93% after general abdominal surgical procedures. Up to 97% after gynecological upfront surgery. Adhesion pathogenesis. Hypoxia. Fibrinogen exudation. Fibrinous anastomosis formation. Peritoneum and underlying vessels injury. Abdominal adhesion complication. Abdominal adhesion can cause abdominal pain, intestinal complications, infertility, increases the risk of damages to internal organs, urinary system and vessels, omentum, bleeding, hematoma, infection, fistula formation, increase the rate of hospitalization and risk of reoperation. To avoid all these problems, now you have a solution. Fensal Antiadhesion Solution. Fensal is a polyfunctional anti-adhesion fluid controlling the 3 fundamental mechanisms responsible for adhesions. 1. Separation of the injured peritoneal surfaces during the critical phase of adhesion formation, the first 5 days. 2. Reduction of local inflammatory response at surgical sites, anti-inflammatory and anti-exudative effects. 3. The anti-hypoxic and antioxidant action. Fensal is intended to reduce adhesions both during and after surgical interventions in abdominal and pelvic cavities in the pleural space, etc. Indications. Fensal is intended to reduce adhesions both during and after surgical interventions such as pelvic, obstetrics and gynecological, abdominal with any microscopic perforation, laparoscopic intervention especially gastric sleeve and gallbladder removal. Mechanism of Fensal is produces a physical barrier tissue effect, providing for a temporary separation of the surfaces of the abdominal organs, pelvic organs, and the organs of the pleural cavity through lubrication provided by the product. This phenomenon minimizes tissue contact during the critical postoperative period and after surgical procedures, thereby preventing adhesions and avoiding the risk of pain and/or infertility. When administered intraperitoneally during surgical procedures, Fensal remains on the site of application for sufficient time to avoid the formation of adhesions, thus substantially reducing the incidence, grade and severity of postoperative adhesions. Fensal has an impact on the 3 main stages of adhesions forming. Anti-adhesion provides a separation of affected peritoneum surfaces during the critical period of adhesions formation. Anti-inflammatory and anti-exudative effects, reduction of local inflammatory response at surgical sites, anti-hypoxic and antioxidative activity, and also improved bowel motion which led to decreased hospitalization stay. Unique formulation. Hyaluronic acid. Naturally bioabsorbed and highly soluble polysaccharide. Non-immunogenic and non-toxic. Does not provoke allergic reactions. Sodium succinate. Has high buffer capacity. Maintains cellular energy homeostasis. Improves microcirculation and antioxidant protection. Fensal has the advantage over other products, and the table shows that. Approved data for Fensal from clinical effects of hydroflotation shown below. Correction of microcirculation and acid-base balance in the abdominal cavity. Dioco. Renown Medical Group. The exclusive agent in Iraq.